A study this month out of Yale School of Medicine says that your race may have a big impact on the quality of your cancer care that you receive. News 12 Connecticut Sean McCabe has that story.
We spent a lot of time looking at the database during 2021, and that's when we found some of these very striking findings.
Senior study author Dr. Sajid Khan says his team was inspired by the racial disparities the pandemic revealed in COVID outcomes.
We wanted to see if there's a difference in the quality of surgery one receives based on race and ethnicity.
Using a database that tracked 72% of the U.S. cancer population over 15 years, researchers found stark differences in the outcomes for Black patients with gastrointestinal cancers.
You're less likely to have adequate number of lymph nodes removed if you're African American.
Black patients with certain types of cancers were found to have close to 30% lower chance of successful surgery. Dr. Khan says African Americans are also more than twice as likely not to be given indicated radiation treatments after surgery.
When we look at if they were actually recommended radiation therapy by their provider, we find that Blacks were less likely to be given the radiation therapy compared to whites.
While it's hard to pin down exactly where the disparity comes from, Dr. Khan says implicit bias from healthcare providers is a likely factor that starts with the way we train physicians.
So I think that has to do with communication, the way our education system is structured in the United States for medical care.
He says the studies that drive treatment strategies may not be accounting for biological differences from one race to another.
Those studies are underrepresented in minorities, and I think the biology is being underassessed. The differences in the biology that can be introduced by race and ethnicity as well.
Sean McCabe, News 12, Connecticut.